Because you may not remember all the instructions given to you by your physician before the surgery, this visual script is designed to instruct you and answer some of your questions for your recuperative period in the comfort of your home. You may have received some specific instructions from your physician. His instructions and advice should be followed. This script is intended to make your physician's instructions clearer.
Well, good morning. I have some good news for you. You tolerated your procedure very well. You should be able to recover in a relatively short period of time. With the proper care, you should be back to your normal self within 2 to 3 weeks. Of course, everyone heals differently, and there are some things that you can do to help in your recovery. Come on in, Leslie. This is my nurse, Leslie, with a few instructions for follow-up that will help in your recovery.
You're looking good for someone who's just had surgery. Once you get home, you'll want to rest in bed. You'll be more comfortable off your feet, and the medications that you've had for this procedure won't wear off for 4 to 6 hours. Keep your walking to a minimum for today, just to the bathroom and around home, and absolutely no lifting of anything heavier than 2 to 3 pounds, about the weight of a half gallon of milk for the next 2 weeks.
If you haven't already, it's important that you urinate sometime within 6 hours after your procedure. If you don't, I want you to go to the emergency department of your hospital right away, and they'll catheterize you or put a tube into your bladder.
You have stitches that will dissolve by themselves in about 3 weeks after surgery. During that time, you may notice that the area becomes inflamed and itchy. You might even have some pain and a feeling of fullness.
There'll be drainage the first week that might have an odor. This should gradually decrease as you heal. You could experience a false urge for a bowel movement. Expect a little bleeding for your first few bowel movements. This bleeding may go on during bowel movements for as long as 6 to 8 weeks.
If the bleeding is heavy, or if there is bleeding other than spotting when you're having a bowel movement, call the doctor. You have a pressure dressing where the doctor did the surgery. It will be in place for 24 hours. This will help control any minor bleeding. After 24 hours, keep one of these ARD or cotton pads over your rectum at all times. It will help keep the area dry. Do not use toilet paper, napkins, tissues, or anything else next to the surgical site. Only use cotton or cotton pads. You can drive only after you stop taking prescription pain medication. Try sitting on a pillow for added comfort. Remember that aerobic, yoga, or other stretching and active exercising will need to be postponed for a few weeks.
I'm giving you a prescription for pain medication. The level of pain varies with each patient, and I'd like you to take this for the next 2 days, even if you aren't having a lot of pain. Taking the medication before the pain becomes intense will help control the pain.
Directions on all medications should be followed carefully. Read the instructions provided for you by the pharmacy. Then if you have any questions about your medication, call the pharmacist or your doctor. You're not allergic to this medication, are you? It's always important to verify that you're not allergic to a medication that is prescribed for you. Certain medications must be taken with meals, and some are better absorbed on an empty stomach. Have your pharmacist tell you which would be better for your medication. After the first 2 days, you can try 1 or 2 over-the-counter pain tablets, other than aspirin, every 4 hours for mild pain as you need to. Some pain medications can cause nausea, vomiting, constipation, itching, or a rash. If you have any of these symptoms, call your doctor. If you need refills or a change in your medication, please call during regular office hours. Typically, refills or changes in prescribed medications are not done during weekends or after hours because the doctors do not have your records when they're out of the office.
You'll need to take a sitting hip bath or a sitz bath 5 to 7 times a day. Each sitz bath should last 15 to 20 minutes. Be sure to test the temperature of the water before you sit in it. You'll want it as hot as you can stand it without getting burned.
If a portable sitz bath is not provided for you by the hospital, you can get one from a medical equipment store or sit in 2 to 3 inches of water in your bathtub. Start this sitting bath once you remove the pressure dressing 24 hours after surgery. Do not add anything to the water. The circulating hot water is cleansing and promotes circulation and healing. This helps reduce pain and the expected swelling that comes after surgery.
We encourage you to begin some mild exercise like walking or whatever your mild exercise routine was before surgery, and some of your normal non-strenuous activities as tolerated in about 4 days.
Mild exercise will increase your strength, stimulate your bowels, and will help you get rid of gas. Walking is the best exercise at this time. Start out with 15 to 30-minute walks as tolerated and increase the time according to your ability. Activities that you did before surgery shouldn't cause any problem for you if gradually started again. Although we encourage mild exercise, avoid lifting heavy objects or children. Swimming is allowed after 4 days after surgery, as long as you shower afterwards and then reapply the dry cotton pad to your rectum.
Regularity in bowel movements is necessary for good health, meaning that regular patterns are healthy, not loose stools one day and then 4 days of constipation. Diet and exercise are very important to your recovery and your continued health. For about the next 4 months, you should take a dietary fiber supplement. These products work by increasing the volume of stool through water retention. They only work if you combine them with enough water and roughage, such as bran, fruits, and vegetables. Take a tablespoon of this fiber mixed with a little juice or water every morning. This is sold over the counter, so you won't need a prescription. Leslie, why don't you explain what the right diet is?
Now this takes me back to nursing school. A proper diet consists of at least 6 glasses of fluid every day and roughage, which we get from grains, cereals, fruits, and a variety of vegetables.
For the first couple of weeks, you should take a stool softener every day or at least until the stitches dissolve. You can get stool softeners over the counter. They are generally taken at bedtime. Also, drinking 4 to 6 ounces of regular grocery store prune juice at bedtime might act as a mild laxative. I suggest you try to regulate your diet by eating roughage and drinking water so you can get into a routine of having a regular bowel movement.
You should go lightly for several weeks on dairy products like milk, cheese, and ice cream, as they tend to cause gas and might add to constipation and bloating. Also stay away from spicy foods for a few weeks or foods that might give you excessive gas or diarrhea.
You don't need to have a bowel movement every day in order to be healthy, but bowel regularity is necessary for good health. The main objective here is to avoid constipation and fecal impaction. Using dietary fiber supplements, stool softeners, and good eating habits, you should be able to avoid constipation.
If you do all of these things and still haven't had a bowel movement for 2 to 3 days, the doctor might want you to try a warm tap water enema. It works best when it's given in the knee-chest position, and it can be repeated once if necessary.
If you're having any diarrhea, which is more than 2 watery bowel movements in one day, you can take over-the-counter medication if your physician approves it, and follow the directions on the package.
If this doesn't stop your diarrhea, then call the doctor. Your next doctor's visit is probably already scheduled. In case it isn't, be sure to call the doctor's office when you get home or in the morning. Have your questions ready for the doctor at this appointment so he can give you more information about your procedure or your recovery. You may want to write down your questions before the visit so that you don't forget to ask something that's important to you.
Doctor, when can I start drinking alcoholic beverages again?
As long as you're no longer taking prescription pain medications, alcohol is fine in moderation. You should call immediately, however, if you experience inability to urinate, continuous bleeding, severe pain which is not relieved by the pain medication, nausea after you stop taking the pain medication, vomiting, itching or rash in areas outside the surgical site, constipation which lasts longer than 48 hours, fecal impaction, or a temperature above 100 degrees.
Remember, if you follow these instructions carefully, your recovery should go smoothly and you should be able to resume normal daily activities within 2 to 3 weeks. Please review this video again and contact your physician's office if you still have questions that are unanswered. To your health.